Right, so to talk about today's session, I'm really delighted to welcome you to it. It's the second session of our autumn-winter series of HAPPI Hour, which is our free regular webinars and which are made possible by the support of the UKRI. So in today's session is supported by a fantastic cast of speakers. So we've got Nathan Downing at the Tech Services Association, which is the industry and advisory body for technology-enabled care in the UK. We also have Gary Bailey at Bield Housing and Care, who are based in Scotland and is one of the 6 TAPPI test beds. We also have Paul Burney at Anthropos, which is a connected care platform that enables intelligent remote monitoring. And Anthropos is also a tech partner of the Bield Scottish test bed. And last but not least, we will have Richard Curry from the Department of Computing at the University of Portsmouth. Right, so for today's session, really as we enter the last few months of the second phase of the TAPPI project, which is due to conclude in December, and keeping in mind the digital switchover, we wanted to provide an update on the findings of the TAPPI project. So we will also in today's session consider the research at the University of Portsmouth on ambient assisted living and how this can ensure improved use of technology-enabled care at home. So to talk about TAPPI, so most of you already know about TAPPI, but for those who don't or would like to know more, so here's a bit of background. So TAPPI stands for Technology for Our Aging Population, Panel for Innovation. And it is a project which aims to improve the way technology is used in housing and care for older people. It is chaired by Professor Roy Sandbach. It's funded by the Dunhill Medical Trust, and it is supported by the TSA and the HousingLIN, with further support from our co-production and engagement partner at Co-Production Works, and also our evaluation and shared learning partners at the Cambridge Centre for Housing and Planning Research. So the first phase of the TAPPI inquiry, which concluded in October 2021, was all about listening and gaining insights from and creating a set of 10 overarching principles that could inform a new framework for all stakeholders to refer to in the context of how technology can transform the landscape of everyday living environments for older and disabled people. And now in the ongoing phase 2 of the TAPPI project, which is, as I mentioned, due to end in December 23, digital services and solutions are being assessed using the original 10 TAPPI principles in 6 demonstrator sites, also known as test beds, in England, Wales, and Scotland. And the aim is testing those principles and ensure that the evidence gathered in the first phase is built upon and used to create a TAPPI framework. So in today's session, we're going to focus particularly on the Bield Scottish test beds and explore the work they're doing with their tech partners, Anthropos, and share some of the emerging lessons from this project. Also to coincide with today's HAPPI Hour, where we're really thrilled to announce that Anthropos is joining the HousingLIN family of sponsors. So we've got Paul joining us today. So Paul and his colleagues bring great expertise in digital care solutions for our sector, gained from being a TAPPI partner, but also their work on the UKRI's funded program, the Longitude Prize on Dementia. We look forward to collaborating with you, Paul, and with your colleagues, and share the learning from these exciting projects with our members. Right, so before I hand over to Nathan, I just want to remind you, please make sure to post lots of questions in the Q&A box. So while our speakers are presenting, if you can post as many questions as you can in the Q&A box, we'll then direct them in the last slot of this session during the audience Q&A. Right, so without further ado, I'm now going to hand over to Nathan Downing, who's the Director of Membership and Consultancy Services at the Tech Services Association. And Nathan is co-chairing with me today. And we'll start by giving you a brief update on the second phase of the TAPPI program and the work done in the 6 testbed sites. All right, over to you, Nathan.
Thank you, Jerome. I hope everybody can hear me okay. For once, I'm not going to use any slides to talk about stuff, because I think what you'll hear from today and from those contributing is a lot of the richness, the flavour of things that really happened on the ground that you can really get to grips with. All the learning, hopefully, into TAPPI is helping you to think about where you would like to start and where you would like to get to. And I would, of course, and I'm sure Jerome will do the same later on, ensure everyone points themselves to the HousingLIN website, to the TAPPI 2 microsite, because it is full of content. Over the next few months, you'll see more and more stuff added on. So for those of you that don't follow up on the TAPPI cast on a regular basis, that gives you everything you need to know. And I think what we're seeing from TAPPI, which I'll come on to some of the other pieces of learning, but most importantly, the personal stories, that everybody's learning from each other about the personal stories that really tell you how somebody is achieving what they want to achieve in life, where they want to achieve it, where technology is playing a role, but it's not being tech-led, it's very much outcomes-led. And over time, how do we all learn from that and encourage those that might commission your services to think differently about how they commission those? So you'll start to see there's a template on there about how would you go about creating your own personal story in whichever service you might commission, provide, or indeed the solutions you provide. And I would urge everybody to take a good look at that, because that really is part of the key learning from TAPPI. This is about people, obviously, but it is about everybody having a role to play in trying to help share those stories, so that everybody and all of you on the call will have a different starting point. So whatever comes out of TAPPI in terms of the tools that we'll talk about, particularly those from partners such as Co-Production Works and the Cambridge Centre for Housing and Planning Research, they're to be taken in based on you starting from a different point. But that said, the learning has been excellent so far. We now need to come up with some tools to support people to do more learning and obviously put that into action. So taking it forward from the papers into practice. Most importantly for me, is vision into strategy. The learning from the TAPPI work around where does technology fit, most importantly, having a good conversation with people right up front to understand what do they want to achieve, whether they are residents, tenants, staff, families, is crucial. That can help you lead to creating a vision and a strategy for the way you deliver services in the future, which I know I expect Gary will mention, but other sites across the UK have looked at it really thinking, well, we've never really engaged with technology before, but frankly, now we really understand, have spoken to the people that we support, we understand what they want to achieve, and then where does tech play a role? But frankly, technology on its own will not make a difference. It is very much around the service side, and therefore the second learning is about workforce, how to help your workforce not to become frightened of the technology, to feel more confident, to not see that technology is taking over from their role, but frankly to see where it plays a role in helping to guide them in the right direction. So I would hope Paul will start to talk about how you can use insights from data to help direct you to where you should intervene and when, and then how you tap into services that can support people to do more for themselves. The biggest finding I would suggest across the whole of the last 12 to 15 months has been something that should be in everyday life for us very obvious: connectivity. So whilst it's not quite represented as one of the 10 principles, it's weaved throughout. Connectivity is crucial to the point at which actually having connectivity, having Wi-Fi within your situ is almost at the point of being a standard and must have a human right. It allows people to be connected with their communities, their families all over the world, services. But most importantly, technology, it will struggle to connect with the outside world without it. And yet, I think a lot of the feedback we've had from testbeds and other people around the UK and beyond has been that struggle, that if you don't build that into the fabric of your building right up front, it can be quite an expensive mechanism to put in place, and yet it is crucial to allow this all to happen. So any of you that are thinking about planning the next wave of extra care facilities, supported living, etc., you have to make sure that you're having those conversations with your partners in architecture, in construction, right up front. It's about the fabric that weaves throughout the building to allow you to then to tap into all the technology that you hear about throughout the TAPPI testbed sites. That technology, of course, yes, there's an element that is safety critical, people needing to alert in an emergency. But for me, far more of the work of the learning from TAPPI is about people wanting to get on with everyday life. And therefore, you'll hear about people wanting to use GPS devices to give them that reassurance that if they go out into the community and fall or they feel lost, people will be able to reach them, not watching what they're doing all the time, but reach them in emergency. People being able to be proud of their home and keep it clean and tidy when their mobility starts to become a struggle. So robot vacuums has been a big hit independently across the test bed sites. There isn't been some kind of collusion that says let's come up with the same things. Actually, everybody's found similar things together. And then simple things like kettle tippers, allowing people to keep entertaining friends and family when they come round, rather than feeling isolated and not having that confidence to entertain. That can be crucial to help people to manage their own independence, rather than saying, actually, now it's time for somebody to come in and do all this for me. So I think technology can be simple. It can be more complicated in some people's eyes, but actually all of it is providing people with these nuggets of information about how best to support people and when. And I guess without my ramble going on too long, I guess a couple of further things would be, don't be afraid to challenge. One of the greatest things we've seen in TAPPI is the engagement between the test beds, the people they support, their staff, and technology suppliers. Challenge those that supply solutions to say, how are you going to help us to achieve the outcomes we want to achieve? Not just, can we have a demo of your latest gadget? Help them to understand what it is you're looking to do. So think about a problem, think about how the solution would support, and then what's the service that helps you to use that solution to its fullest effect, rather than being too tech-led. And for me, always remember, as we'll come on to in the rest of this discussion, when we talk about supporting people through from a housing environment, it isn't just about older people. It's far broader than that. It is an all-age approach. So solutions need to fit with different types of people with different conditions and different times of their lives. And actually, people will be confident and comfortable in engaging with technology if they understand what's in it for them, they understand how it supports their outcomes, and they feel like they're being engaged right at the front rather than done to. And I would hope you'll see from all the stuff that's going to come out from TAPPI, these are the simple tools we've been thinking about. So we will create a simple approach to technology-enabled care, how you can engage with your suppliers in the right way. A data security questionnaire, because some of the battles for everybody has been, how do we help our ICT colleagues understand what we want to achieve, and we don't necessarily understand which country service is sitting in or how secure data is. So how do we help you with simple bits and pieces that help you to ask those questions up front and involve everybody up front, rather than waiting till it's too late and then almost having to take 10 steps back and start again. So from a TSA point of view, we're happy to talk to anybody about our learning across the test bed sites, also the learning we're doing around the country to support lots of housing providers to look at their shift from analog to digital and not view it as a like-for-like switch out from a technology point of view, but really see it as an opportunity to do far more with digital to better support your tenants and residents. That's my soapbox over, but I'm happy to answer any questions later on. Thank you.
Great, thank you, Nathan. That's brilliant. So yeah, I propose we move on then to the next presentation. So we're going to have a presentation by starting with Paul Burney, who's a Chief Commercial Officer at Anthropos, and it's a joint presentation with Gary Bailey as well, from the who's TAPPI Program and BR24 Service Manager at Bield Housing and Care. So they're going to explain the Bield TAPPI test bed and how Anthropos, their technology partner Anthropos, are supporting them.
Super.
Over
Thank you, Jerome, and it's a pleasure to be finally joining one of that HousingLIN events. We are very happy to have joined as a sponsor. We think the work that has been done on TAPPI is extremely important in developing our industry forward, and we've been delighted to be part of the Bield experience in a small way. We've learned probably more from them than they have from us so far. But I'm going to talk maybe for 5 minutes about what Anthropos is and does, and then more interestingly, perhaps Gary will talk about how they've used it and the kinds of results that they're getting in amongst the other things that Bield have been trying. So I think really the simple starting point is to say, what is the question that almost everybody has on this call when they meet a new technology or a new technology provider, which is, how is your technology going to help us support people to stay safe, well and independent in a place they're choosing for longer? And our simple answer to that question, which is a complicated question, but the simple answer is this: we want to provide you with intelligence that supports you to make better informed care decisions. And that's what the whole idea of our platform is. the idea is that we will give you a view of what is happening in the lives of the people in your care in the other hours of the day when they don't have a carer present and they don't have a family member present. So how can we give you a better understanding of those people's lives and their patterns of behavior and their care needs, and by doing that allow you to make a better informed decision about the care that they receive. So we're big believers in the fact that models of care are changing. We've been used to a past of kind of in-person care and reactive care only, the kind of telecare world of button and a box. Now where we're at is we have the kind of the advent of proactive and preventative technologies. In the future, we will move towards predictive technology being involved, but nobody's there yet. Nobody has the volume of data to be able to do that. So our focus right now is how do we use proactive and preventative technologies? And why would we do that? Well, you know, all of the people involved in care, both health and social care, are moving towards having more person-centric care models, and a key element of that would be to understand more of the person's care needs and understand more of what they require in their life. If we can understand better and we can adjust the care that they're receiving, we can, and the evidence is there to support it, we can avoid people going into hospital or being readmitted into hospital. If we can do that through better person-centric care models, then we can deliver better care experiences and better care outcomes. And alongside those things, the technology can support better capacity management, better effectiveness of using staff when all of those people are under pressure to deliver more for more and more people with fewer and fewer staff. So there are some pretty key drivers towards why you might want to move towards more proactive services. So how does it work? Simply put, we put devices and sensors into the homes of older people. Those capture some data. That data goes to our platform. It processes and analyzes the data to produce a picture of the life of that person based upon the environment in which they live, their behavior or their daily routines, their physiological well-being, and their safety and security. Having built that picture, we then use machine learning to look for changes in any one of those 4 areas, and we give you back intelligence about those changes in either reports or analysis or alerts and insights, which I'll explain a bit more about in a second. And we can send that data to anywhere. It can go to our own dashboard and our own app, but equally we can send it to alarm receiving centers, care management software, to nurse call systems, to business information systems, wherever you want it to go. So actually, Anthropos is the bit in the middle. What we're good at doing is processing and analyzing data and turning it into usable intelligence that's made to make better care decisions. So it can go anywhere and be used by anybody else. And we use that in a range of products, primarily in a product that we used in long-term care, which is one of the ones that Bield are testing, which is basically to monitor activities of daily living. A second product called Anthropos Detect, which is used for managing falls. And a third product, which is available now, which is used to understand falls risk for people who are in all kinds of different care settings. So essentially, the kit that's been put into Bield includes motion sensors that pick up movement and detect also temperature and light, door sensors, fridge sensors, smart plugs for the kettle and the microwave, and a couple of passive fall sensors that we're testing to see whether we can pick up whether people fall without them having to wear buttons or press anything or interact with any other technology. And essentially, once we picked up this picture of people's daily patterns and routines, we then look for change, and those changes are streamed into 1 or 2 ways. If we see a change that suggests someone needs help immediately, so perhaps they've had a fall, they've opened the door or left the property in the middle of the night, or they haven't started their day as they normally would, for those we generate alerts, and those need to be dealt with immediately. For everything else, every other change that we see, we grade it as an actionable insight, and those can be things that pick up changes in patterns of movement, changes in bathroom visits, changes in sleeping patterns, change in using fridge, microwave, or kettle. Those don't require immediate action, but what they do is they suggest to a care provider or to a family member that something is changing in the life of that older person that is worth looking at. Ultimately, we're looking to answer 3 questions about the life of those older people we're managing. We want to know Are they okay right now? Is something changing in their life that means they need help right now? Is something changing in their life that's worth us considering for longer term changes? And that data can be accessed in multiple other formats as well through reports and analysis on the platform. In the future, when the next stages of TAPPI and the next stages of what Bield will do, we are likely to add more devices that give us more data. We will continue to build upon the machine learning that sits in our platform at the moment. We'll integrate with lots of other systems. So in fact, Anthropos will probably disappear into the background, but the intelligence that we create will be supporting other systems that want another care models that want to deliver proactive care. And we know that our tech will be used in kind of combined solutions that work across housing, health, and social care. So I'm going to hand over to Gary in a second, but if I can get you to remember nothing else from this presentation other than this one thing, it's the whole point of connected care is to provide you with intelligence that supports making better informed care decisions. We won't be making decisions for you. We're not replacing people. We're just there to give you a better understanding of the care needs of the people you are looking after and perhaps enable you to make a better decision on their behalf. So with that, I'm going to hand over to Gary. Gary, when you want me to change the slides, nod your head or shout and I'll press the button for you.
Perfect, Paul. Thank you very much. And hello, everyone. Thanks for having me here today. Hopefully just going to round up Bield's TAPPI journey within the next 5 minutes, which is quite a challenge in itself if I'm being completely transparent. But what we see on the screen here to start with is our 10 TAPPI principles. And this is the concept that Bield have been testing. We've been looking at these principles and how we can test these, not in theory, but in practice, which has then evolved to help inform our new corporate strategy, which we've just launched. Now, I'm not going to go over these one by one. I'd highly recommend following some of the links in the chat that Jerome put in earlier to read to more around these TAPPI principles. But certainly it's gave us the opportunity to work with our tenants, putting our tenants at the heart of what we're doing and focus on a co-produced approach to exploring how technology can support our tenants live independently in their own homes for as long as possible, which is ultimately our end goal. One of the TAPPI principles that really stands out throughout this, and there's a full theme which we'll go into in a second, is the person-centred and the co-production piece. Now, everything that we've done through the TAPPI journey within Bield is putting our tenants at the heart of what we're doing. So if you could go to the next slide, Paul. So what we've done throughout that is created a co-production strategy, a brand new strategy, and actually the first within our organisation that was produced with the tenants and approved by the tenants. In terms of our TAPPI journey, we've now engaged with just under 500 tenants. Now, we do have 4,500 and something tenants within the organisation, so we're sitting at just over 10% of engagement, which has been fantastic. But we're working alongside our tenants to find the solutions that work for them and the right solutions that they are looking for. One of the interactions with that is our TAPPI champions have come along to supplier meetings and meeting the suppliers. So, for example, myself and 2 tenants met Paul at the start of our TAPPI journey, amongst many other. And actually, on a personal level, taking tenants to supplier meetings was fantastic because there is no filter and they can ask the questions that maybe you feel too reserved to ask or that you're trying to word politically. So involving the tenants at that stage has been fantastic. It's building their knowledge and their know-how, and it's gaining that lived experience, and it's ensuring that we are investing in the right tech for them and that understanding's across the board. Our tenants have been involved with every decision that's going to affect them, and they have signed up to test these technologies in their own home, as well as agreeing to put these technologies into our brand new digital hub, which we've opened. And that digital hub is a showpiece for our tenants to come and engage and, I suppose, educate on technology, if you like, but also benefits our workforce and our wider external partnership side as well, because we're trying to bring everyone in the fold to show how technology can support independent living. And actually, it's not about replacing people, it's just enhancing how our people work smarter with our people. And I suppose the most important thing there's the outcomes and focusing on the right outcome from that person based on the information we're gaining. So with our co-production approach, looking at new innovation, And I must admit, it's been quite refreshing on this journey because we've been able to have a dedicated resource to look into the technology piece, explore the art of the possible with our tenants, and that interoperability piece is a big bit. Paul touched on that earlier, and one thing that we've found throughout our journey, which has been great, is it's not just around the Anthropos sensors, it's that openness to engage and incorporate other solution provider software onto the one platform to allow easy access for our workforce to ensure that we're focusing on the right outcomes for our people. So we're taking our co-production, our innovation and our learnings from TAPPI, and that's really informed our co-production strategy and a big focus on our independent living offer. We're testing the art of what is possible with our tenants and with our staff, understanding both digital literacy skill sets and where we sit as an organisation, and linking in multi-departments on how we can improve that and how we can engage throughout to ensure we're moving forward in the right place. When we fast forward to the 6 or 8 month mark, we're in a position now where we're actually looking to create an innovation hub, which is fantastic for us. We're looking to renovate one of our closed assets at Coxland Gardens and create a living environment. So what is going to be our standard design, our standard housing offering for our customers moving forward? And that's going to incorporate a wide range of different technology-enabled care solutions, but also link into our adaptations process. And a big piece of that's been through the learning journey, with the TSAs being a key partner throughout this, creating pathways which we can incorporate down the line, which will involve seamlessly integrating tech into people's homes at the right time when they need it. So for example, not every tenant's going to move in at 55 years old and have a flat full of tech that they may or may not need. It's around choice base, it's around getting the right tech for that person at that time. And we're going to showcase art of what we will offer as standard, but how when an individual's needs change, we'll be ready and equipped to adapt with the person, and we'll be ready to support them on that journey rather than reacting as we go. So a good one to end on, just put up here the customer impact so far. We've had nothing but positive feedback throughout the tenants that have taken part in the journey. We've seen great family outcomes as well, you know, family concern. We've got one lady who recently moved into a development at the start of the year. Our son, only living relative, is a businessman away on travel with work all the time, really concerned for her health and well-being, and was phoning every day. You know, have you done X? Have you done Y? Putting a real strain on that relationship. Fast forward to now, with the predictive and analytical technologies in our home, he's got the peace of mind that she's being supported at the right time in the right way. And that's reduced the weekly phone calls to 2 or 3 calls a week, but it's more, how are you doing? And that's enabling better relationships. In terms of our workforce, we do have our Bield Care at Home team. They're currently trialling how the technology is working in people's homes, and we're looking to build a few case studies on there. But we've had a fantastic outcome so far, where we've already caught a UTI, for example, at early stages, and potentially prevented a crisis moment where we've needed healthcare intervention. So there's definitely a lot of pros coming out of the test of change that we're doing. And I suppose for us, now that we've got our strategy in place, it's looking at that scalability and what's next. How do we roll this out amongst our tenants, and how do we get it right for Bield as we move forward as an organisation with our people at the heart of that? And with that, that is my last slide. Thank you very much.
Brilliant. Thanks both. That was great. Really interesting. So yeah, fantastic. Please just reminding our delegates, please post as many questions as you can. So if you have any questions for Gary or Paul, just don't hesitate to post them in the Q&A. Great. So now we're going to move away from the TAPPI project for a little bit, but remain staying with the technology theme of today's session. We're going to move on to Richard Curry, who is going. Richard is a senior research fellow in the Department of Computing at the University of Portsmouth, and he's going to talk to us about ambient assisted living and the next steps in supported living and how to amplify the message. So over to you, Richard. Let us know if you need any support, Richard, with your slides. It seems everything is going fine. Perfect.
Good. Can everyone hear me?
Yeah, very well.
Yeah, good. Well, good afternoon, and thank you very much indeed to the HousingLIN for giving me this opportunity. I'm really just talking about, you know, a slight move forward. Ambient assisted living. I want to show how it offers a huge opportunity, and along with other developments that are taking place, at long last to knit together housing and care. It's over 10 years now since the Marmot Review articulated the social determinants of health. Specifically, the review stated that poor quality housing harms health, and evidence shows that exposure to poor housing, including damp, cold, mold, and noise, is strongly associated with poor health, both physical and mental. So the home, keeping people comfortable and safe and living independently, is where the focus of healthcare should be. Keeping people, especially the elderly, out of hospital with good community care, or returning them to a place of safety with good community care, should be our objective. Technology, referred to as telecare or assisted living, has been used for many years to help with this. Initially, the approach was reactive, to report on adverse situations such as a fall or medication non-compliance. More recent assisted living installations have included sensors that can infer a change in health and social care status, such as sleep apnea, going out and leaving the door unlocked, not eating or drinking, as well as reporting on physiological measurements such as blood pressure. At the same time, we've seen the development of the smart home. This involves the use of networked sensors to measure and control the home environment. We're all familiar with central heating controls, but smart homes go further, remotely optimizing heating and energy usage and monitoring for such things as carbon monoxide, humidity, and light levels, thus controlling comfort and safety. The next step is to combine assisted living and smart home technology to follow an individual as they go about their activities of daily living, ensuring their comfort and building up a picture of how they live. Then it is possible to intervene if a potentially unsafe situation is occurring, such as a distraction during cooking, or our expected activity is not taking place, such as failure to wash clothes or keep an appointment. Such an installation is referred to as ambient assisted living, because it makes no demands on the individual to change their routine or wear devices. It requires no human intervention, as alerts are raised automatically, either with the individual or with their carer. Furthermore, all data processing is done in the home, so it's essentially a private system. Modern computing techniques, such as machine learning and natural language processing, can make such a system a reality. And several university research groups in the UK are pursuing this line of work. Many universities have built what they refer to as a living lab to provide as realistic an environment for the work as possible. This is ours. In the Portsmouth Living Lab, we've done work on supporting people with autism and with ADHD, working with Autism Hampshire. We've met with the Portsmouth Hospital Public and Patient Involvement Group to develop a survey tool to determine the acceptability of ambient assisted living and find out what the barriers are. Whilst it's easy to say that care at home and illness prevention through good housing should be the goal, we all know it isn't easy to do. However, I don't actually see that we have any alternative. There is going to be no solution to the shortage of community care staff, which was estimated at 112,000 by Skills for Care 2 years ago in 2021, and the inexorable rise of the elderly, which I am one. So this whole thing has a degree of personal interest. So we must work smarter. By that I mean we must adopt the technologies that I've talked about, make as much use of technology as we can. Fortunately, I believe there are 3 changes on the horizon that can help. The digital switchover in 2025 will mean that every house has access to the internet. There's bad news, however, as you all know. If you currently have a telecare service over the analog system, you've got to tell your user, your phone provider and your telecare provider before switchover, which is going to be hard. How many elderly people are going to be able to do that? So it's going to be down to providers to do that. But the good news is that now every home is able to take advantage of the technologies of ambient assisted living services. It will be there as of right. Communication will be there as of right. Second thing is the beginnings of the regional and area integrated care services, which consider the patient journey from community to hospital and back to community by assembling teams from social care, home from hospital, district nursing, and specialists such as podiatrists, dietitians, and physiotherapists. We've already mentioned that it's important to be part of that team. Finally, the use of virtual wards, which was born out of COVID, but their use, I think, is an encouraging start, meaning the health and care services are beginning to understand that they can deliver service this way. So in summary, I would say that researchers need to develop ambient assisted living products, and service providers need to incorporate them in their offering. Importantly, integrated care services need to include ambient assisted living as an integral part of providing a home care support service. So thanks very much indeed for listening to that. To what my view of where we're going. I'd just like to thank my colleague Reinat for his contribution, and for any of you who want to know a little bit more about our research group, the website is down there. Thank you very much.
Thank you, Richard. Thank you very much. That was great. So yeah, thank you all for all our speakers for keeping to time. I think it's very impressive. We're right bang on time, so we're going to move to the audience Q&A now. So thank you for all your questions. I see that Gary and Paul have been busy typing answers. So that's great. But I think just for the benefit of our audience, for those who haven't read the answers, Gary, would you mind just you answer the question to Christine Winstanley about where she asked, have you found age a barrier to adoption, and how have you navigated this to ensure success? Do you mind developing your answer?
Yeah, no, not at all. It was a great question, especially at Bield. We specialise, if you like, for housing for older people. But one thing we say in Bield is we're all in training to be old, or that we're just young people with experience. Mm-hmm. But I think one of the key takeaways to the success was a co-production approach. You know, not excluding any of our tenants, but actually engaging with what TAPPI is and what we want to achieve throughout that. Working with Cambridge University, as Nathan mentioned earlier, they developed a questionnaire which we engaged with our tenants, which helped us understand their digital literacies at this moment in time, and what we could do to build on that on an individual level. By taking tenants on our journey with us, they were able to gain that lived experience and that buy-in, and we've used that as a strength. So our TAPPI champions, our tenant committees, and the wider tenant group that's involved have been going out to other developments, speaking to other tenants around that experience. And I feel then we've got the right mix. Certainly our TAPPI champion age ranges to the late 80s. Now, we do have tenants well in the hundreds, which is fantastic. 6 of which actually stay where our digital hub is and who have been down getting hands-on with the technology, both technology-enabled care and consumer tech, may I add. And it's been fantastic just to ensure they're involved. And I think that's been the key message, involving the tenants on the journey rather than implementing solutions and advising here's what we're doing. It's from tenant to organisation rather than us putting it out there.
Yeah.
Gary, if I can add to that, so as I was, let's put it nicely, I was on the receiving end of questions from your tenants.
Yes.
The two things that stood out for me, one is that they ask questions that nobody else has ever asked me, other than other kind of service users. But also it forces you to talk about the way that technology works in a way that's relevant to those tenants. And it's quite clear when you're engaging with people, even though it was on screen, whether your explanations worked or not. And so there was a desire to find ways on my part to kind of help them understand why the tech was relevant to them and what benefits it would give to them and to their families. I found that actually quite a really an enjoyable part of the whole experience. Certainly different than filling out DPIA forms and that kind of thing.
Yeah, Paul, at the start of your presentation, you mentioned that you learned a lot from working with Bield on this TAPPI project. I was wondering, do you have any kind of examples of how it has influenced the way you provide your service, maybe, or how it's influenced how you approach partnering with other housing associations?
Yeah, and in fact, Gary's just mentioned something on screen in answering one of those questions about looking for the early signs of a UTI. And it prompted us to look further at our data. And in fact, we've got another project underway with Sheffield City Council, where we're kind of taking that first kind of learning experience from Bield of looking for a UTI, and we're seeing whether the platform can spot the earliest signs of a UTI in enough time that someone can be tested, proven to have a UTI, and then get antibiotics that avoid them going into hospital. And the first example of that seems to have worked for us, although it's kind of one or two isolated examples. So there's things that we're learning and feedback from the way in which Bield are using the tech that influence how we see our tech working. But then the second part is, as I said, is finding ways of talking about the tech without talking about how the tech works. I think that's really valuable for us, because it means that when we go to talk to other housing providers, we have a better understanding, I think, of what housing associations and others may be looking for, and change the way in which we tell our story. There are some people who we engage with who really want to know, how does the platform work? But the vast majority of people have very little interest in knowing that it's IoT devices with a machine learning backend that uses logistic regression and advanced statistical analysis to look at changes in people's behavior. That kind of thing is not so important. The end outcome is, can you make a better informed care decision if you know what's happening in the other 23 hours of the day when that person is not in receipt of care? And the answer should be yes.
Yeah.
So that's it's a longer answer perhaps than I should have given to him.
No, that's perfect. Thank you, Paul.
Yeah, I mean, what I'm trying to get across is that whilst this is true, we can go round to each housing association and put in some kit, and we can talk to their users. At that, I've been in this business for a very, very long time, and that's happened innumerable times. We've had very successful projects within the limits of the technology at the time, who then don't go any further because the funding runs out, or the enthusiasm runs out, or something happens. What I'm trying to get across by my comments is that if we could integrate this with the standard way of care delivery, the way that the Department of Health and Social Care says is a good way, is the way of doing it, the way that they will fund, then instead of assisted living, or what I want, ambient assisted living, being a bolt-on, it is integral to the whole thing. Nobody makes a move unless they. I think you made this point, Gary. You should, it should be cynical. I know you should. If you're building a care facility or designing a care service, you design technology in. In the same way that you would design in podiatry, in the same way that you would design in physiotherapy, in the same way that you would design in other services for other people, other groups of people with chronic conditions. You design in the right pieces of technology to help do that. Whether it's physiological monitoring, and I'm interested in comfort, because I think if people are comfortable, then they're happy, and if they're happy, they tend not to have, if they've got chronic conditions, they can cope because they have a coping mechanism. It's when there's mold on the ceiling, or when they've got a heating. We could find out, because of all the data, we can mine that and say whether they've got problems with paying their heating bills. And that's just as Marmot said 10 years ago. Mm-hmm. And that's just as important as knowing that they've got COPD.
Yeah, very good point, Richard. Thank you. Nathan, do you want to add something?
Well, I guess, picking up on that and a few of the questions, I think, without being too flippant, I think technology is the easy bit, and I think what we're, it's about what do we do with the potential raft of data. So rather than this being exercises in how many graphs can we produce, or who's got the data science expertise to do this, this has to be very simple, basic information, or using Paul's system and the way he described, or what does AI mean, and machine learning, that most of us probably didn't quite comprehend, because he's right. It's about simply taking the data and putting it into a simple format that shows people in some kind of either a traffic light system or a simple insight, this is the action you need to be taking. It allows staff to then feel empowered and comfortable. And frankly, the technology does morph into the background. It doesn't physically disappear. There's still going to be sensors on the walls. But actually, these days, the sensors don't all need to look the same. If people don't want one that looks like an eyeball, you can have it looking like something different. The technology, the widgets, can be interchangeable. It is very much about the data and being clear about what is it we want to achieve, and how do we empower staff and families to take action, as well as things in the community that people can access, that will be the thing that meets their own outcome. It doesn't have to be for every time a certain notification is sent, you have to send this person around to do this activity to this person at that time. I think the conundrum in all of it, because I think funding's been mentioned several times, is unfortunately we're in a position, particularly where health and social care, and particularly, I guess, from a health perspective, there's a lot of firefighting goes on, reacting to crises. We've got a lot of demand coming from the hospitals, etc. What we need is to create a bigger evidence base for this being done at scale, which I'm sure most people say, well, how do we get the funding to do that in the first place? Well, that's why we've got things like the Dunhill Medical funding this TAPPI program. We have Sheffield City Council investing in solutions like Anthropos and others to understand how does it change their way of thinking, a test of change, for example. How does it help them inform their future commissioning? And I think the one part we haven't really touched on from TAPPI so far is the power of the TAPPI champions. So having those tenants being the very people that will show their colleagues how to get on with the tech, how not to be worried about it, because there is something about not everybody picks things up at the same pace. Some people are more comfortable with Facebook and WhatsApp now, but wouldn't touch it before. So how did their very peers talk to them about, look, this is what you should be doing, this is how you should try and use it. We almost need an Apple Store Genius bar, but within supported living and extra care. Some people, tenants, to help each other, to say, come along and let's work together on how we can set up your iPad, for example. I don't know, Gary, if there's something you just want to touch on, because it was one of the comments about how do you help people feel comfortable.
Yeah, absolutely, and it takes time. But by involving the tenants, involving our workforce, we can't do the right thing by our tenants if our workforce isn't equipped with the digital skills and knowledge to support them. We can't assume our staff have that skill set. So we need to start with the basics. We need to start with our workforce, build up their confidence, and then take that to our tenants, work in partnership with our tenants, and create that safe environment where they feel they can come to us with those questions. But I completely agree, taking the tenants on that journey has been so powerful. And that's formed our business as usual now within Bield.
It is, but they are just one member of the supply chain.
Yeah,
you've got to take the policymakers with you. You know, if we don't find a way of doing that, if we don't find a way of creating a robust business case, which is so compelling that they really can't afford to duck it, then that's what I want. That's what I think as well as being very involved with the technology, it's my colleague Reinhard, who's the technologist. He's the one who understands all the hidden Markov models and stuff like that, which is we don't reveal to anybody because nobody else understands it but a pointy head. But the interest for me is, how do I overcome what I've seen in the past 30 years is an awful lot of trials, awfully successful, and then, but we don't seem to manage to make that final leap into into that they being an integral part of the care service. And actually, it's because more and more care is going to have to be delivered at home, that actually it's the HousingLIN that I come to talk about this problem, because although I take a home, I would, you will obviously extend to institution settings as well. Other people go into care homes, they have to. But those for me are the what, and I'm hoping that the TAPPI principles, which are very good, although I would say privacy is a big one. That's the thing that we've found in our survey of the acceptability, is that privacy, and the key now, of course, is that the power of computing is so high that you can do the processing in the home, and so the information doesn't have to go outside. Only information going outside the home is alerts, but a lot of the alerts are given because we see a potential dangerous situation occurring. Somebody's cooking. You watch. You see, they're cooking, and the machine says, "What? They've walked away." So you just say, "Oi, shouldn't you concentrate a bit here?" And that's why we focused on people with ADHD and autism, because they do easily get incredibly, distracted, and they do things like this. And I know from a housing association point of view, that leads to burnt out buildings or flooding or worse.
Yeah, I think that's absolutely key what you've just said there, Richard, and certainly up in Scotland, we're quite fortunate. We have the Scottish Digital Office. Now within Bield, we've got our very own alarm receiving centre, and part of our process and governance up here is we are on the Secured Assessment Supplier Scheme, which essentially means we've been through cyber security and penetration testing, ensuring that safe connectivity for our tenants, for those alerts coming through for us to follow up on. And anything that we do at scale moving on from this, we'd be looking for the same processes in place, just to ensure that that data is safe, it is secure, and that we can move forward as one, knowing that our tenants are safeguarded.
Oh, it's absolutely key, because if it goes wrong once, the sun will have hold of it.
Absolutely.
And oh boy, we'll be set back another 10 years.
Right, thank you. So we've got about 3 minutes left, which is annoying because we've got lots of very interesting questions we'd love to answer. So, I mean, I propose for our audience, if there are any big questions you have that we haven't answered, if you want to send them to our info@housinglin.org.uk, if you send us these questions, we'll happily reply to them in due time. I think we just have time for one final question. I saw one which has disappeared, actually. I think somebody may have replied. Which one was it? Oh, I've lost it. Anyway, Nathan, did you have a question you wanted to ask?
I suppose a quick one for Paul and Gary in particular is the whole point around ethics, consent, best interests, data handling. Clearly, these are key questions people want to know. Anything you want to say about how you have worked together to ensure that data is kept safe, most importantly, that people have been involved in decision making?
So fundamental starting point is that the service user owns all the data, and they give permission for that data to be shared with anybody else, whether that's the care provider, family members, or us. And at any stage, if any service user says, I no longer want to be monitored, and I don't want you to keep my records, the entire thing can be expunged from our system in seconds. And we've had to do that in the past when people have asked for it. So the starting point must be to recognise that the individual, is in command of all of their data. There needs to be obviously a process of consent in getting them to share that data, and informed consent. Clearly, where they have capacity, they make that decision themselves. Where if they don't have capacity, it can be made in their best interests for them. I think in the Bield world, everybody has capacity, and so that they've all given their permission with the ones who were on the programme, Gary.
Yeah, that's correct. So we ran engaging workshops with our tenants who wish to participate, and with the drawn up data protection agreements that were in place, our internal Bield's GDPR officer came along, had a conversation, and broke down some of the terms that are throughout the service level agreement before they signed it, answered any questions they may have if there was any misunderstandings, and we ensured that everyone was on board and comfortable before integrating that process. We did include families as well, or give the option if they'd like families to be included in those discussions. So we were very transparent and open, and we addressed any concerns that came our way before the tenants signed on a dotted line.
Great. Well, thank you, everybody. So it is 5 p.m. So, I mean, we still have lots to discuss, I'm sure, but maybe I can just go around the table if there's one last message you'd like to give our audience. Maybe if we start with Richard, if you'd like to.
Well, there's obviously a huge number of questions in the Q&A, and I'm more than happy if you circulate them to respond to them. Okay,
brilliant. Thank you, Richard. Paul, any last message?
Yeah, likewise, happy to answer those questions. I've tried typing along what I've been answering to answer those. And there were some really good questions in there that I think deserve longer answers than what I was able to type in seconds. I finished with the same end message I always give to people, which is it is about giving you intelligence that helps you make better informed care decisions. Not about the tech, not about the devices, not about the platform. It's about the end output and how we help you do your jobs better.
Great. Thank you, Paul. Gary, one last message.
Yeah, just to echo both Paul and Richard, I'm happy for my details to be shared. If anyone has any questions, Paul, echo yourself with some fantastic questions in that chat still at the moment. If I could leave you with any message, it would be the future's closer than you think, and tech's going to play a part in that, and it's around embracing that and getting on the journey, and overcoming the barrier. But include everyone. Don't be afraid to include everyone that's near you and around you. You'll end up with a support village, which is essential.
Brilliant. Thanks, Gary. Great. Nathan, one last
word. Everybody stole my thunder so far, so I echo everything they've said. But plus, I would say those that are looking at the digital shift, mate, from a technical point of view, from thinking about the telephony changing, don't just focus on a shift from what you've already got and turn it into a digital version. Really have a think. Our job is to help you along that way to take care of some of those technical issues. Think about what you want to achieve, and then start to find partners to work with on this as open as possible.
Excellent. Right. Thank you very much, everybody. That was a great session. So I'd just like to remind our audience, so if you want to keep following the TAPPI the TAPPI project, so we do the HousingLIN publishes a weekly TAPPI cast that you can find in our HLinks weekly bulletin. So we give brief updates about the program, and also interesting reports that have come out during the week, and also events of interest. So make sure to read these. I think one last note is really thanking all our speakers today. It was a brilliant session. Thank you, Nathan, for co-chairing the session. Always a pleasure. And last one final more thing is that please remember to complete the feedback form once we close this session, and also book your place for next week's session, which we will focus on sustainability and zero carbon, and we'll discuss how we can provide comfortable and eco-friendly living environments for all the people, while contributing to a greener and more sustainable world. Great. So thanks again, everybody, and see you soon. Goodbye.
Thanks, everyone.
Thanks, Bye-bye.
Bye.